prove it. So we are going to do Mythbusters with a lot of frequently asked questions that we encounter in our practice here. So let's practice. We're going to ask for your involvement and your... So let's practice. Here we go. Dr. Dimitri is an expert sarcoma medical oncologist. Fact or fiction, everybody? Yay, very good. Very good. So we'll get started. So we're going to ask you for your whether you think it's fact or fiction, the things that we'll present.
So we're going to start off the bat with nausea, which is a common symptom that we hear from patients, either related to their cancer or to their anti-cancer treatment. So I am on anti-cancer therapy, so I should be nauseated. What do you think? Fact or fiction? Fiction, good. So a lot of our patients are on once daily dosing, so a simple fix sometimes can just be simply moving the medication time of day. So if you take your Gleevec in the morning, sometimes moving it to the evening can solve the problem. So this can be a little bit more complicated for our patients who are on twice daily dosing medications, or they have specific restrictions such as it has to be taken on an empty stomach, or you need to take it with food. So other ideas that can be used to eat smaller, more frequent meals, to avoid offending agents, which you might already know which foods bother you. High fatty and greasy foods are known to induce nausea for a lot of our patients, as well as caffeine and carbonated beverages. We highly recommend you talk with your team to talk about consideration of a medication. And a lot of times it's really helpful for us to know when you're nauseated. Is it all day? Is it half an hour after you take the medication? And then we can pick the right medication for you, as well as pick the right time of day to take the medication. We also have a great team of nutritionists at our disposal, as well as a pain and symptom management team that can be really helpful in managing symptoms of nausea when they're particularly complicated. Sorry.
Don't look at the bottom.
I don't know what happened. So diarrhea and constipation, also two common, either together, one than the other, or you might have one more than another that we constantly hear in clinic. So what do you think? Is it normal to have diarrhea more than 8 times per day? Yes. So, sorry about that. All right. So many treatments that we give for both our GIST and our non-GIST patients can lead to diarrhea or constipation, as can surgery, radiation therapy. We could do dietary changes. For like a brief period of diarrhea, we'll recommend like a BRAT diet, bananas, rice, applesauce, toast, bland foods. And to avoid foods that cause diarrhea, which you may have specific triggers that you're aware of, but high likelihood ones include all the ones that I have listed here for constipation. For constipation, we recommend a high fiber diet. Fresh or frozen or even dried fruits and vegetables can be helpful, and beverages include prune juice, and there's a product called Smooth Move Tea that can be very helpful for some patients. We also think that when it comes to diarrhea and constipation, medications can be very helpful. Obviously, for constipation, stool softeners and laxatives, and for diarrhea, there's a number of anti-diarrheals, either over-the-counter or prescription. So, sorry. Yeah. So this is one that we actually get a lot, and you can find all over the internet. And it's basically that a bar of soap, particularly Ivory or Dove, or Dial, can cure leg cramps. Oops, sorry. So some patients actually do report that this helps. I don't know. If anything, this might be a placebo effect, but the good news is if you try it, it certainly is not going to hurt you. We recommend that you talk to your team about supplementing with calcium and or magnesium. Increase the hydration in your diet, and that's not just water, taking into account maybe smart water that includes electrolytes or vitamin waters, Gatorade, Powerade. There's a number of products out there that I'm sure there's one that you wouldn't mind. And then some gentle stretching exercises before bed can also be helpful. So fluid retention, our patients on Gleevec are often plagued with that one, as are a number of other patients. So one that we have heard, Preparation H, can help for puffy eyes. High salty foods do not contribute to leg swelling, and I should be losing weight on my anti-cancer therapy. What do you think? Fact or fiction? You guys are good. So preparation H is actually just really meant for hemorrhoids, not to be used on the nice thin skin around your eyes. It actually can cause eye irritation and can have the reverse effect if you use it too frequently. We recommend that you minimize the salt in your diet, and salt can actually be hidden in a lot of foods, like deli meats, TV dinners, even lean cuisines are very, very high in salt. So we recommend that you look at the nutrition facts on the box before you buy. Some people say sleeping with your head slightly elevated, propped up on pillows can be helpful. And the other thing is we don't generally tend to tell patients that you're going to lose weight on treatment. Some people do, but I think it's more frequent that our patients gain weight. So, perfect. Pigment changes or skin colorations. What do you think? My hair is turning white because I'm getting old quickly, and sunblock is not necessary in the Northeast.
Anybody? Fact or fiction?
Yay. So some treatments that we give, particularly sunitinib and pazopanib, are known to cause your hair to go white, and it will come back when you're off treatment. And we actually encourage sunscreen for all of our patients because it is essential when you're either on treatment or off treatment, or if you're, some treatments that we give make you more sensitive to the sun and can increase your risk for sunburns. And so we recommend high SPF sunscreens, protective clothing, broad brim hats, and all of that to protect your skin. Okay, now Amy's going to take over.
Any questions before we start to talk about another few common things? Go ahead.
Oh, I think they encourage at least 15, but I myself wear 70. So
I'm going to go with 30 plus here.
Yeah, 30 plus.
But higher the better. So a lot of medications that we give, both for GIST and for sarcoma, including standard chemotherapies, can have oral toxicities. So I just wanted to talk a little bit about management of oral toxicities. So a couple things here I'd love to hear from you. Do you think buffalo wings, potato chips, and minty toothpaste are recommended by your team? Alcohol-based mouthwashes such as Listerine can be helpful sometimes. And a white coating on my tongue is normal. Okay. So most of these are fiction. So just a couple facts here about oral hygiene and management of oral toxicities. So we definitely recommend avoiding certain foods if you're having an oral toxicity related to your therapy. Salty, sharp, or crusty foods like potato chips or bagels can irritate your mouth if you're already having mouth irritation. Minty toothpaste can be a nightmare for some people that are having oral toxicity, and we definitely recommend avoiding acidic or hot and spicy foods. We definitely recommend using gentle toothpaste like Tom's of Maine or Sensodyne if you're having oral toxicity, and Biotine is a great mouth rinse that lots of our patients use. Always use a soft toothbrush, and talk to Kathy, myself, and members of your team about how to manage your oral side effects. We're really lucky here at the Dana-Farber. We have at the Brigham and Women's Hospital an oral medicine specialist that is really particularly interested in the toxicities associated with the therapies that we prescribe. So if it's a challenging case, we always work with that team to manage. So hand-foot syndrome. This is another topic that we encounter a lot in our group, both from GIST-related therapies and also some chemotherapies that we use can cause this toxicity, which is a little different from the way it happens when you have GIST therapy. So I know the answer's up there, but there is nothing to be done to help the pain in my hands and my feet. Fact or fiction? Thank you. So some facts about management of this toxicity. We recommend usually from the onset of prescribing medications that are likely to or more likely to cause this side effect to start using moisturizing creams from the get-go. So when you talk about this with your doctor and when you get the prescription, we recommend that you start using really heavy emollient creams. Bag Balm is at the pharmacy. There's something called Udder Cream, and Eucerin is really good. And if you develop this toxicity, we think for some people it's helpful to apply liberal amounts to their hands and their feet and then put either a sock or a cotton glove over, and so the absorption is maximized usually while you're sleeping. But be careful not to fall down if you're putting lotion on your feet. Urea-based creams are over the counter at the pharmacy that can be helpful. Certainly wearing comfortable shoes, gel inserts can be helpful, and avoid or minimize offending activities. I have more than one patient that walks barefoot in different situations and has a flare of their hand, particularly their foot pain. So just discuss with us if you have any questions about that. So blood work, this is a really basic one. I'm expected to have some changes in my blood work with treatments, and certainly that's a fact. I think everybody here that's a patient is used to getting stuck all the time. We ask a lot of you, and we are constantly checking your blood levels for certain reasons. We look at your red blood cells, your white blood cells, your platelets, liver functions. I could go on and on. Thyroid hormone as well. And these sometimes people will need red blood cell transfusions, and we see changes. And sometimes we have to make treatment modifications because of this, and this is expected. Pain is a big one. So a couple myths here. If I take narcotics prescribed to me for pain, I will become addicted, so I would rather stay in pain. Constipation related to pain medicine will improve with time, and I have always had a high tolerance for pain, so I can handle being in pain. Fact or fiction? Thank you. So some pain management facts. We want to know if you're in pain. We don't expect you to live in pain, and it's something that we want to manage. And we'll help you to find the appropriate doses of either narcotic pain medicine or non-narcotic pain medicine. Certainly people can build up a tolerance to narcotic pain medications and may require increased doses over time, but you will not get addicted to pain medications if you're taking them for the right reasons. So it's a common misconception when people say I'm in pain and I say, let's start you on oxycodone or something. Oh, no, I'm going to get addicted to that. If you're taking it for the prescribed reason, you will not get addicted. There certainly are side effects associated with these medications that we will work with you on managing. Fatigue is a big one, especially when you first start taking narcotic medications. A lot of people think that this may get better over time, but there are other side effects associated with narcotics that do not improve, like constipation. So sometimes we find a happy medium with the constipation if you're taking other medications that cause diarrhea, but it's something that we work on. And then we absolutely think that treating your pain improves your quality of life. And then this is a controversial one. So a couple things here. Sugar feeds my tumor, organic foods prevent cancer, and I can eat whatever I want, whenever I want. Anybody? Thank you. So we think a couple things here. So maintaining a healthy weight and exercising as tolerated is definitely recommended. We know that in some malignancies like colon and breast cancer, patients who have obesity issues or other issues are shown to have higher rates of those cancers and potentially recurrences. So we think that just doing the best you can with eating a healthy diet and exercising as you can is the best thing for you. We are definitely seeing some clinical trials excluding patients who have diabetes, for example, or some heart diseases. So across your life, to do the best you can to be healthy is a good thing. There's absolutely no data to show that organic foods prevent malignancy, and that's a personal preference. And then the sugar issue is absolutely controversial. I definitely don't have the answers to that. I think that there's no data to show that that contributes to the growth in sarcoma. But overall, we just recommend that you maintain a healthy lifestyle. And if you have specific questions about it, to talk to your team. And that's what we talked about for our Mythbusters. And these are our children. So any questions about anything?
So the earliest forms of GIST, they don't cause pain, they don't cause symptoms. You have to stumble across them. Either surgery is done for some other reason, and then the pathologist looking under a microscope finds a little teeny thing, like 2 millimeters in size. This one, 2 millimeters in size. You know, a centimeter is a small part of an inch. 2 millimeters in size is a small thing indeed. You can hardly see this with the naked eye. It certainly blends into the surrounding tissue. But you know what? These little GISTs, and here, actually, do we have a pointer? Yeah? Here, small GISTs are what I'm going to call microgysts or baby GISTs, these little teeny guys. They have the same KIT mutations. A study, we're out of power here. A study that we recently carried out with good colleagues and friends in Italy, Paolo De Tos, showed that fully 75% of these tiny early little GISTs have the same KIT and PDGFRA mutations that the big bad ones do, the ones that are life-threatening, the ones that cause clinical problems. So this is a remarkable thing. We can identify these early GISTs that have the same mutations and then study the sequence of events that pushes them along to being a bad clinical problem. Of course, the relevance of that is that the more we know about the genetic progression of GIST, the more therapeutic targets we're going to have. If you can identify some new gene that pushes a GIST from a very early, pretty harmless thing, and I'm going to come back to how harmless, to something that starts to cause problems, then that can almost certainly be a new point of therapeutic